All right, so Dr. Prashant will be delivering the most important talk, which is how do you teach adults? So, adult learning principles. Thank you.
Thank you, Meena. And first of all, thank you, Ophthalmology Foundation, as well as the All India Ophthalmological Society of India, for giving me this opportunity to talk about very important aspect of education, which is adult learning principles. I think we have all seen the phase in our life where we have experienced the learning as children, and then we graduated to learn as adults, and now we are participating in learning of adults. I think one thing that probably all of us will agree, that learning is not just the gaining of new knowledge, but a new knowledge through a transformational experience. And I think as a medical educator, we have ample opportunity to really experience what we learned the best. Something that you have felt in the clinics are one which are long lasting in our memory. I do not have any financial disclosures. The objectives of my talk will be to discuss with you how adult learners are different from pediatric or children, to describe some of the theories of learning, particularly relevant to adults, and then how do we apply that knowledge whenever we are dealing with adult learners. Now, before I begin my talk, I'd like you to pause for a while and think about what are important characteristics of adult learner. Just think about that. Do you think that the statement that I made, that adult learners are different than children, is it correct, and in what aspect they are different? What kind of classroom or training activities have been most effective for you as an adult learner? And then what are one or two activities that you usually include as an instructor, and we will discuss that in the discussion sessions. I think a typical educational experience that we had in our undergraduate medical school is this kind of a classroom. Professor walks in, start writing on the blackboard, in my time blackboard and probably PowerPoint in this time. Some of the good teachers used to ask questions to students in order to engage them. Typically, all the programs are where you have to cram a whole lot of knowledge from books, notes of the professors, or the journals in the library stock. And at the end, your learning was always assessed by a qualifying exam at the end of the semester or at the end of the course. I think all of us are also familiar with this reality that half of the class with some professor used to feel like the attendance is necessary, therefore I should be in the class, otherwise I don't care about what they teach or what they do not teach. And other half where the teacher is interested in, and they just keep on writing notes so that they can recall them just before the exam. Even if the teachers were asking questions, yet another experience has been there are some forefront students who will always raise hands and will hijack the entire class, not allowing other students to even participate, or providing the food for them to sleep and ignore all the learning that is happening. So while the class looks that the teacher is interacting with the student, in a true sense, many students are not really participating. Now, it is a time when we all have become educators to reflect upon. We can teach the way we were taught, or we can teach keeping in view the way people learn. And I think here it will be important for us to recognize that teaching or training does not translate directly into learning. And the learning is not equivalent to performance in actual life situations. So let me come to the topic. Adults and children have different learning styles and different needs is a fact. This fact was first highlighted in 1968 by McCallum Nowell, who gave certain characteristics of adult learner. The adult learners are usually self-directed. They learn better if they know what is the relevance of the learning. And for that, they require an internal motivation. They all have prior knowledge and experience, and they very well relate to their prior knowledge and experience, any new knowledge that is put forth to them. The knowledge becomes more effective if it is task-oriented. If they are engaged in certain activity, they are able to understand that better. And all adults learn in an environment where they are truly respected. These are some of the differences between children and adults, and I need not go into the details of what the children learn, but you can see that on many fronts, the adult learners are different than children, and therefore the same strategy that we use to teach children cannot directly be translated to adult learning. Another breakthrough research came about transformational learning, and it reflected the psychological behavior of adults. And this is that whenever a new knowledge is put forth to adults, they go through a disorienting dilemma. They really question, is it correct what he or she is telling? No, I don't agree with that. And after some time, they start to recognize the discontent and the need to transform. And finally, they are able to integrate the new perspective into one's life. And the author described 10 steps through which an adult goes through in order to bring that change and make it as a part of their life. One another very popular theory for adults learning is by David Kolbe, who popularized the experiential learning. That is, adults learn better when they experience activity, and they learn better when they reflect upon that experience. So if we can incorporate providing experience, giving them opportunity to reflect upon, and then based on then reflection again try to it in real life situation, then that learning becomes permanent. As I told you, adults usually want to have a control on their learning, which includes right from goal setting to self-planning, self-monitoring, and self-evaluation. It is very well known that if you engage adults into different kind of projects or activity, then learning is far, far better as compared to giving them didactic. For example, now I am giving didactic, but if I could have combined some activity along with it, then I think the learning would have been much better. So the next question is that how do we apply this knowledge, these characteristics of adult learning principle into actual learning sessions that all of us are moderating? The first thing that we have to keep in mind that adult student must consider a goal achievable. If they believe it will be difficult, learning may not happen. And therefore, as a learner, it is our duty to really set those goals such that they feel that these goals are achievable, and don't not put them that this is so difficult, you will not be able to, or you will have to work hard and all of that. That's a negative connotation on that. As far as being respected is concerned, I told you that adult learners like to be respected, treated equally, allowed to voice their opinion, and to have a role in directing their own learning. So it is important that residents, when they come in our clinics, we treat them like future colleagues, make them feel part of the department, and involve them in social and department activities. The third characteristic is responsibility. And what do we mean by? The adults learner have self-concept of being in charge of their life, responsible for their own decision, and want to be seen as being capable of their responsibility. And to facilitate learning, it is important that we discuss with them learning goals, enable periodic assessment, provide periodic feedback, and help them to modify goals. Real world application. As I said, that adults want to relate all the learning into the real life situation, what we call as a sense of purpose. So provide learners a real life situation where they can exercise their learning and how the learning is going to be useful to them. For example, if we have to talk about the clinical signs that help differentiating different etiologies of corneal ulcer, you can talk that there are clinical signs that will allow them to identify etiological agent, and therefore a good clinical examination is must. Adults bring experience to learning and is well known, and therefore we can put the questions which are asking them, how will you manage this condition? How you differently manage these two different severity of corneal ulcer. Now that way, whatever new knowledge you are giving, they will be able to relate to their past experience and become better. See, do, teach. Adults are task oriented and like to be able to apply knowledge, and therefore we should involve demonstrations and opportunities for a student to do themselves and teach peers. And this is a very well known fact about learning, that whatever you do is retained for a longer period of time rather than listening or watching. And therefore, to enhance learning, organize contents around task. Clinical education settings are very ideal. Expose trainees to all the practical experience that you center. And for that, you can even consider small group activities that allows them a safe, collaborative learning environment. Another important rule is 70-30. In any lecture, a teacher should speak only 30% of the time and allow students 70% of the time. And that way you will be able to engage larger number of people. This is difficult in 10 minutes talk, but in a classroom setting that can be done. To summarize what we discussed, that adult learner need to gain the confidence by when we set the goals that are achievable. They want to be respected, responsible, and want to know how the new learning is going to be applicable in the real world. See, do, teach is a very good strategy to enhance the learning experience of adult learner. To conclude, adults have different learning style. To be effective, we need to modify our teaching practices. These are simple and inexpensive. Only thing it requires little creativity. Thank you very much for your